Thank you, Madam Chair. My questions will go to Mr. McKay. I'm looking at YouTube's community guidelines related to COVID-19 medical misinformation policy. It says that YouTube doesn't allow content that spreads medical misinformation or that contradicts the World Health Organization's or local health authorities' advice. Does this mean that Google and YouTube are now taking responsibility as a platform for determining truth about public health information during a pandemic?
No, we're looking to public health authorities who have the experience and the expertise to provide guidance on what they consider authoritative information.
So if you're not looking to take responsibility, then why do it?
Sorry, why apply the guidelines and battle misinformation on YouTube? Because our users...
I guess I would contextualize the question. In January, the World Health Organization said that there was no evidence of human-to-human transmission of the coronavirus. Would YouTube have removed a video questioning that at that point in time under this policy?
I'm sorry, I can't speak to possibilities. I can only speak to the practical experience we've had.
Sure. So in that practical experience, would YouTube, this community guideline, would it have applied to videos or users that were talking about using masks to prevent the transmission of COVID-19 when the WHO was advising or quiet on that issue?
I think that the policy itself is applied to instances where there's an explicit threat to personal safety or health, and where there's the possibility of personal injury. So in the case you're describing, whether it's the use or non-use of masks, we would still turn to WHO and public health authorities to give us guidance on it.
I'm reading directly from the policy, and it says that the policy would remove content that, quote, contradicts WHO or local health authorities' guidance on treatment, prevention, diagnostic, and transmission. So I think it's a little broader than that. So would this policy have applied to content that was, let's say somebody posted a video saying that border control measures do work when the WHO was saying that they don't work?
We try to apply the policy as broadly and effectively as possible. And the reality is that we're facing circumstances day to day where we're dealing with misinformation on a much more significant scale. So what you're describing here would sound in our conversation as something that would need to be deliberated. But at the time...
Just as legislators, I'm just wondering if this opens your company up to legal responsibility for determining what is truth in a pandemic situation. I'm just curious why you're taking this position as opposed to just acting as a platform.
We are acting as a platform, but we're looking to informed sources to give us the information so that we can ensure that authoritative information is going to our users. We also take.
So what about in a situation where the quote informed source is wrong, as the WHO has been?
I think one of the advantages of our platform is that there is ongoing debate and opposing points of view available in the content that is made available by our users.
But your platform community guidelines say that it would remove content that would have an opposing viewpoint to the WHO.
And I think in practice, when we're dealing with issues of particular notoriety and severity, we're acting quickly and we're following those guidelines.
Again, I'm just wondering if, again, because there seems to be some ambiguity here on the purpose of this policy, would you say it's less about misinformation, more about perhaps upholding existing political dogma on a certain topic?
No, I would say that it's wholly about providing authoritative and reliable information for the user.
And I'm just curious, if I post this clip to my YouTube channel, will it meet community guidelines?
Sorry, I don't see how it wouldn't. It's being broadcast right now, and we're having a straightforward conversation with an obvious difference of opinion.
Thanks. I'll end my comments there.